Hi everyone. Sorry for the long gap. I couldn't get time to prepare videos for you. Hereafter, I'll try to upload the videos periodically. Okay, fine. So, as many of you requested me to take classes on virology, so I have decided today to take class on three viruses. Okay, that is MMR, measles, mumps, rubella. Now, let us see one by one. First one is measles. Okay. Next is mumps. The third is rubella. Okay. The first is measles. Before going into these three viruses, you must know one basic things, that is as a common point, that is MMR plus 2 pox. 2 pox is nothing but smallpox and chickenpox. So for these five viruses, there are few common points, that is humans are the only reservoirs for all these conditions. So no animals, no animal reservoirs. Cases are the sources of infections. Okay, which means there are no carriers for all these viruses. Next, lifelong immunity. Once a patient gets infection with these viruses, they develop lifelong immunity. Okay, natural immunity. The last point, common point, is live vaccines. All are live vaccines. Okay, yes, fine. Now these are the common points for all this MMR, that is measles, mumps and rubella. First one is measles. Okay, measles, here it is the most common cause of childhood rash. Okay, and then incubation period is 10 days. For mumps, the incubation period is 19 days. For measles, the incubation period is 14 days. And for mumps, it is the most common cause of childhood parotitis. Okay, which means infection of the salivary gland, parotitis. Next, which means the incubation period is what? The period between the entry of the organism till the symptoms appear, which means the 10th day the symptoms starts. So 10th day symptoms like fever. Okay, next is Koplik spot. Okay, Koplik spots. The next is rashes. So this fevers occurs on 10th day and Koplik spots appears on 12th day. Then rashes appears on 14th day. 10, 12, 14. That will be the clinic. This is the clinical manifestation of measles. Okay, fever followed by spots and then rash. So spots, the site is buccal mucosa. It is bluish spot. Okay, on the buccal mucosa. Next is rashes. Rashes usually starts appearing behind the ears. Okay, this is the clinical manifestation of measles. Coming to the complications, complication is secondary bacterial infection. Okay, that is pneumonia. Okay, next, measles induced encephalitis, CNS manifestations. The next is SSP, subacute sclerosing panencephalitis. Okay, so this is the clinical feature and this is the complications. Here, important thing which you have to know is called inclusion body. That is Warthen Finkeley inclusion bodies. It is a pathognomonic sign. Again, the Koplik spots is also the pathognomonic sign of measles. Okay, next we'll move on to mumps. So what is mumps? It is the most common cause of childhood parotitis. The incubation period is 19 days. So after 19th day, the patient start developing the symptoms, that is nothing but parotitis. Along with fever, there will be swelling of the parotid gland, that is salivary gland. Okay, usually it will be bilateral or rarely it can be unilateral. Okay, this is called typical mumps. And there is another term called atypical mumps. Atypical mumps means this salivary gland involvement will be absent. So instead of that, the patient develops directly the CNS manifestation, that is aseptic meningitis. So the complication of this typical parotitis will be in CNS aseptic meningitis. Most common complication will be orchitis. Okay, orchitis, which means it is usually unilateral. Rarely it is bilateral. Okay, as usually it is unilateral, that's why there will be rare chance of developing infertility. Okay. Other complications will be like pancreatitis, oophorytis. These are the clinical manifestations of mumps and then complications of mumps. Next is rubella. Okay, rubella. Here the incubation period is 14 days. So 14th day here are for rashes. Okay, rashes are the first common manifestations along with the fever plus lymph node enlargement. Lymph node, here the most common lymph node involved is posterior auricular. Okay, the next will be, again, in case of measles there will be Koplik spots. Here in rubella there is called Forsheimmer spot. Okay, here the site of the spots will be uvula and soft palate. Okay, so always if a child is brought with a fever, rash or any lymphadenopathy, don't forget to put a torch on the throat, and complete oral examination is very, very, very essential. Okay, next important manifestation of rubella is congenital rubella syndrome, as it is teratogenic virus. Okay, congenital rubella syndrome, here it is a triad, that is ear, eye and then heart. In ear the most common manifestation will be sensory neural hearing loss, deafness. Okay, then in eye, salt and pepper retinopathy and then cataract. Okay, in heart the most common manifestations will be PDA, then pulmonary artery stenosis, then ventricular septal defect. Okay, so this is the classical congenital rubella syndrome triad. This is one. Again, which means if there is any term called classical, obviously there should be another term, that is called expanded congenital rubella syndrome. This is the name of the syndrome is called blueberry muffin syndrome, which means again there is a triad. Okay, here the triad is nothing but hepatosplenomegaly, thrombocytopenia and petechial spots. So this is one of the manifestations of congenital rubella syndrome. Okay, next coming to the vaccine part. Okay, as I said already, they all requires a live attenuated vaccines. Okay, which means they are contraindicated in some immunocompromised patients. So as it is a live, it can turn to virulent anytime. Okay, so here the name of the vaccine is Edmonston Jagrab vaccine. Okay, along with this vitamin A can be given. Okay, next here in case of following exposure to this virus, immunoglobulins can be given, that is measles immunoglobulin can be given or measles vaccines can be given in how many days of exposure, which means in 3 days of exposure either immunoglobulins or vaccines can be given, and it is the only condition where the combined immunization is not done. Okay, so which means no combined immunization, either passive or active vaccines. Okay, active immunization. The next is for elimination strategy. The one strategy which is followed is called KFC, that is keep up strategy, follow up the cases and catch up the unvaccinated kids. That is called KFC strategy. This is called elimination strategy of measles, and it was asked once, okay, in the NEET question or old all India question. So the KFC strategy, actually there is no term called KFC, catch up, keep up, follow up. Okay, the next vaccine against mumps is nothing but Gerald line strain. Okay, the next is vaccination against rubella, that is the strain name of the strain is RA273. So all the three are live vaccines. And here one more thing you have to know is, as I told already, it's a teratogenic virus, which means, and also we are giving live vaccines. So if it is given for immunocompromised patient, for example, even pregnancy is considered as immunocompromised status, so it leads to some congenital manifestation. As it is teratogenic, it can cross the placenta and it can affect the fetus. That is why if the vaccine is given and if the female has been planned for a pregnancy, means the vaccine has to be avoided for at least 28 days. Okay, pregnancy has to be avoided for 28 days of vaccinations. Okay, so that is a criteria for vaccines. Yes. Yes, let's have a quick revision. Measles, mumps, rubella, and two pox, that is smallpox and chickenpox. The common points for all these five viruses include humans are the only reservoirs, there are no animal reservoirs, cases are the only source, there are no carrier states, and once the patient gets infection, there will be lifelong immunity, and all requires live attenuated vaccines. The other common point is secondary attack rate is very high for these measles, mumps, and then rubella. Secondary attack rate is nothing but the other person which may get infections from the infected person. So the chance of getting infection is very high. So first is measles. Measles is nothing but rubella. The other name is rubella. Okay, so it is the most common cause of childhood rash, and the incubation period is 10 days for measles, 90 days for mumps, and 14 days for rubella. And here the clinical manifestations includes after 10th day, that is the incubation period. Once the incubation period gets over, the first symptoms will be fever. So on day 10 the child may develop fever. After 2 days of fever, that is on day 12, the child may develop Koplik spot. Koplik spot is nothing but it will be around 1 mm size, which is on the near the second lower molar teeth, and then spreads to the entire buccal mucosa. There will be bluish spots. So 1 mm size, second lower molar teeth, third day of the clinical feature, that is, or 2 days after fever. Okay, so the next on fourth day, that is on day 14, the patient or the child may develop rashes. Usually starts behind their ears and then spreads to the face, arms, and then trunks. This is a clinical manifestation of measles. Complications of measles include secondary bacterial pneumonia, usually caused by Staphylococcus aureus species and other species. Then measles induced CNS manifestations, and then SSP, subacute sclerosing panencephalitis, that is inclusion body. Deposition of the inclusion body may develop encephalitis. The inclusion body, name of the inclusion body is nothing but, this is the cytopathic effect, that is multinucleated giant cells containing the inclusion body, Warthin Finkeldy cells. Okay, so usually it is seen in both cytoplasm and nucleus. This is the only inclusion body which is seen both intracytoplasmic and intranuclear inclusion body. Okay. So the next is period of infectivity, which means a patient is infectious from -4 days to 5 days of rashes, which means after the onset of symptoms, that is a period of infectivity. Next is vaccine. The name of the vaccine is, it is a live attenuated vaccine, Squad strain or Edmonston Jacob strain. Okay, usually it is given at 9 months. Suppose following exposure to this virus, either passive or active immunization has to be followed, and that too in 3 days of exposure. Okay, so it can never be given in a combined or combination format. Okay, the next is elimination strategy for measles is catch up, keep up, follow up. You have to catch up the unvaccinated kids and keep up the vaccination and follow up the cases. Okay, next we'll move on to mumps. The mumps, most common cause of childhood parotitis. Usually it is bilateral and the incubation period is 19 days. So the complications, again the most common complication will be orchitis, which is usually unilateral. Orchitis is usually unilateral. And then epidermolysis or oophorytis, aseptic meningitis, pancreatitis. Okay, so this is one category called typical parotitis. The other category is called atypical mumps, that is where the salivary gland involvement is absent, so the patient may develop directly the CNS involvement, that is nothing but aseptic meningitis. Here the period of infectivity is, the patient is infectious from -1 day to 1 week after the onset of symptoms. The vaccine is Gerald Lin vaccine. Again, it is a live attenuated vaccine. The third virus, that is rubella. It is also called as German measles. Okay, here the incubation period is 14 days. So on day 14, the patient may develop rashes with fever. Okay, rashes usually starts on face. Okay, along with that lymph node involvement, lymphadenopathy. That is, most common lymph node will be posterior auricular lymph node and occipital lymph node. The next here is Forschimer spot in rubella, Koplik spots and measles. Forschimer spot is nothing but, again, same small petechial spots in the soft palate and uvula. The other important manifestations of rubella is congenital rubella syndrome. So the congenital rubella syndrome includes two categories. One is classical congenital rubella syndrome, other one is transient, which may the patient or the infant may develop later on. So the first classical congenital rubella syndrome, the triad of the classical congenital rubella syndrome is ear, eye and heart defect. Ear defect is deafness, that is sensory neural hearing loss. Eye defect is salt and pepper retinopathy followed by cataract or cataract. Then heart, in heart the most common manifestation will be PDA, patent ductus arteriosus, and then pulmonary artery stenosis, ventricular septal defect. Under the transient changes, that includes blueberry muffin syndrome. Here the manifestations will be hepatosplenomegaly, thrombocytopenia and petechial spots. Along with that, patient may develop IUGR or some any bony lesions. Here the vaccine, name of the vaccine is RA273 strain. Okay, here the important thing is, as the virus is teratogenic, there should not be any pregnancy. Okay, so the pregnancy plan has to be postponed for 28 days. Okay, so which means there is no pregnancy after 28 days of vaccination, especially to avoid the congenital rubella syndrome. Okay, so that's all about measles, mumps, rubella. Thank you for listening. Hope it will be very useful and kindly make use of it. Please subscribe and share it with your friends. Let me see you with a new topic again. Bye bye.